Well, thanks very much. And as I was casually saying, it's really nice to see everyone in person. As everyone is aware, this fourth wave has been very challenging in many parts of the country, and in some places, community transmission of COVID-19 remains out of control, and hospitals are at or above capacity. And I know that many Canadians are really scared right now about what this means, not just for our healthcare systems, but for their own access to healthcare, their own pressing health emergencies. And we also know that Canadians are tired, and I think everybody wishes that the pandemic was over. And I certainly share those feelings, but as we've seen over the last year and a half, we have to keep going, and the best way to continue to fight the virus is to fight together and to stand together against the virus. Je veux assurer les Canadiens et Canadiennes que le gouvernement fédéral est là pour vous et que nous serons toujours là pour vous soutenir. Nous sommes en train de fournir de l'appui d'urgence aux régions du pays qui en ont besoin. Et nous sommes prêts à aider d'autres provinces et territoires si l'aide nous est demandée. Currently, the federal government is providing support to a number of areas of the country. In the Northwest Territories with RFAs that include the Canadian Red Cross and the Canadian Armed Forces assisting with health and human resources and in shelter operations. We're also in a number of provinces assisting with surge contact tracing support, and these are resources that can be accessed from StatsCan. We're providing funding for the operation of safe and voluntary isolation facilities in many sites across the country. And we are supporting with testing with the National Microbiology Lab and a few other federal labs that are helping with any surge capacity. And as has been previously reported, we are providing offers of assistance in our discussions with Saskatchewan and Alberta for health human resources, PPE, medical equipment, vaccines, testing, and anything else. As confirmed last night by my colleague Minister Blair, the Canadian Red Cross and Canadian Armed Forces will be assisting soon in Alberta, and I'm pleased to hear support from Newfoundland and Labrador will also be accepted. Officials in my department and over at Procurement Services Canada will continue to work with both provinces on their requests. As I indicated to my ministerial counterparts provincially, it's very important that we plan ahead for these challenging scenarios, as some types of help are easier to coordinate than others. For example, vaccines, test kits, personal protective equipment, medical equipment, and other things can usually be moved within 24 to 48 hours. But it's health and human resources. That's where the crunch really is, because of course these are people and it takes time to figure out how we can move them around and get them to where they're needed. And the more time that we have to do that, the easier it is to deploy people if and when the time comes that they are necessary. So we all have a role to help with this fourth wave. And of course, the most effective way is to get vaccinated. If you haven't been vaccinated yet, or you have someone in your life who isn't vaccinated yet and is hesitant, please help make sure they get information that helps them make that choice to protect themselves, their families, and their communities. But we can also continue to follow the public health measures that we know are helping. To wear a mask when we're in gatherings, to avoid large gatherings or higher risk scenarios. And of course, if you're in an area where there is a high number of COVID cases, maybe it's time to not attend that outdoor gathering or indoor gathering. Maybe you make a decision to move an event to the outdoors to lower the risk. Every decision that we make right now can reduce the risk, stop transmission of cases, and it does make a difference. Thank you also to the 81% of eligible Canadians who have already been vaccinated. Globally, we have shown the progress that Canada has made on this front, but of course, we still have a large number of people who have not been vaccinated and who cannot be vaccinated. So again, if you are one of the folks that has not yet taken advantage of this life-saving medication, please do so. If not for your health, think of the teachers, the mental health of school children who are so desperate to continue to stay in class this year, or the small business in your community that just can't afford to even fathom another period of inactivity. The faster and the more that we get vaccinated, the faster we can defeat this fourth wave. I know many of you are also eager to know when vaccines might be available for those under 12. We're waiting right now for the companies to submit applications for the 5 to 11-year-olds. And once the application is received, Health Canada is in a very good position to quickly proceed with its thorough review. And so to parents, I know it's been an extremely challenging time. Many parents are still working from home, still homeschooling, providing full-time daycare while also holding down a job, worrying about your own mental health, your children's mental health. And I want to recognize the extra burden that the pandemic has placed on you and your family, and to thank you for everything that you're doing to protect yourself and your communities and your families. Finally, we all owe a huge debt of gratitude to the frontline workers. The doctors, the nurses, the paramedics, the social workers, the respiratory technologists, and so many more, the medical professionals who are dealing with what is likely the most challenging time of their professional careers. And I can confidently say on behalf of all Canadians, we're extremely grateful for your dedication, for your commitment, for your compassion, and for keeping all of our healthcare systems running and supporting the well-being of all Canadians. So thank you, merci, miigwech. And I'll take your questions.
All right. Thank you very much, Minister. We'll start. Nous commençons avec 3 questions par téléphone et après ça, 3 questions dans la salle ici. We'll hand it over to the operator.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Sharon Kirky, National Post. Please go ahead. À vous la parole.
Oh, hi. Thanks so much for taking my question. Minister, Alberta and Saskatchewan this week requested doses of the Janssen vaccine in the hope that it would increase vaccination uptake among those who do not want an mRNA vaccine. Should this option not be available to other Canadians? I'm wondering your views on that.
Well, thank you for the question, and we are working right now on those requests and have also offered an option to all provinces and territories who are interested in acquiring doses of Johnson & Johnson. We will be trying to provide those doses as quickly as possible to the provinces that are currently seeking them. But as I said, the department right now is scanning with all the provinces and territories to see if there's a demand in other regions of the country.
Okay, and one other question, if I may, and it's around the children and the Pfizer vaccine for those under 12. You did mention that, you will be reviewing this and proceeding, but, we're hearing reports that it could be approved for children in the U.S. Within the coming weeks, which means children in the U.S. could be start getting vaccinated by Halloween. Yet it could be, end of year, early 2022 for Canada. I'm wondering why there could be such a delay here.
I'm not sure I have the same information as you. We do anticipate that we'll have an application in the weeks to come from at least one of the 2 companies. And as soon as that application comes in, the regulators are well situated to very quickly review those applications. We've added millions of dollars to the regulatory body so that there are additional scientists and analysts that can and that do work on a 24-hour, 7-day-a-week basis. So we're very well situated, as I said, and those conversations with the corporations are ongoing right now. So we'll have to wait and see how quickly the company applies to Canada. Certainly, I know those conversations are happening, and when they do, we'll be able to quickly review the data and approve when thoroughly demonstrated as safe.
Thank you, operator. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque, La Presse canadienne. Please go ahead. À vous la parole.
Oui, merci beaucoup. Hi, Minister Haidu. The Prime Minister this week put out 5 key priorities in terms of vaccination. I was wondering if we could get a sense of how quickly the government is committed to implement mandatory vaccination for the public service, but also passengers on trains and planes. And when are we going to have more specifics on how this is going to work?
Well, thank you. And I share the Prime Minister's urgency in those objectives. And I'll say that I know those conversations are happening right now in terms of the federal public service with obviously the employers, but also the unions to make sure this happens in the right way. And in terms of passports or proof of vaccination for domestic travel, my understanding is that Transport feels this will be possible by the end of October. So we're moving as quickly as we can on both fronts. Again, to provide people safe workplaces and to provide safety for individuals that are traveling within Canada.
Any idea when we would have specifics? I think the Prime Minister was talking about the next few days, but if everybody has more information on that, that would be appreciated. My second question was, about the cabinet that's going to be announced in the next few weeks. I was just wondering if you were hoping to stay on as Health Minister.
Well, thank you very much for the question. It's, first of all, just been an honor to serve with Prime Minister Trudeau for the past 6 years in his cabinet, and I will serve this country in any way that he asks me to do so. It continues to be a privilege to be a member of Parliament and to be a Minister of the Crown.
Okay, thank you, Operator. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Zach Vishera, Saskatoon Star Phoenix. Please go ahead, à vous la parole.
Thank you very much for taking my question. Minister, I know that you had a conversation with Minister Paul Merriman in Saskatchewan about a potential request for federal aid last week. I understand that Premier Scott Moe also spoke to the Prime Minister about what Saskatchewan might need earlier this week. I'm wondering if you've received any more specifics from Saskatchewan on what they may require to deal with a rising COVID-19 hospitalization rates, and if an official RFA, a request for assistance, has indeed come in at this point.
Well, thank you for the question, Scott. So far, we have not received an official request for assistance from Saskatchewan, although Minister Merriman and I did have a conversation about some of the requests that the province likely will have. We do know that he's asked, for example, for additional monoclonal antibodies, and they have some already, so we're working on the details of what that further need might be. Certainly, a request for assistance will help clarify more quickly exactly what the province is looking for and how we can best help them meet those needs.
Thank you. And a follow-up, if I may, on those monoclonal antibodies. The Premier and the Health Minister in his letter to you were quite bullish on those and said they wanted to see those used much more widely in Saskatchewan. Similar to what is happening in the United States was the analogy, the comparison the Premier used. I'm wondering if Health Canada has an adequate supply of these antibodies to do that. I understand they're expensive. And I'd also like to know if there are any cautions around their use. I understand they're recommended right now for a very select group of patients.
Well, I think the questions around the appropriate use of the treatment would be best left for Dr. Tam, and she'll be here after me. So I'll leave those questions to her around the appropriateness of use and when. But I will say in terms of the supply, we do have a supply in Canada. We also know that Saskatchewan has a supply. And again, once we understand the degree to which they propose to use these antibodies and the timeline, we'll have a better sense of how we can meet the need.
Okay, thank you. And I will take questions in the room if we can alternate the two microphones. I don't know who is in first, but we'll start over there and come over here.
Hi there, Minister. Travis Stanraj, CBC News. Thank you for taking our questions today. Minister, I just got an email from the Chilliwack Progress. This is just published in the Chilliwack Progress. It's a picture of the Prime Minister relaxing on a patio yesterday with a beer next to him. Many Indigenous people are outraged the Prime Minister traveled to the beach in Tofino to be with his family on the first National Truth and Reconciliation Day, rather than, for example, accepting an invitation to visit Kamloops, which he flew past. What's your reaction about the message that sent to Canadians, specifically Indigenous Canadians?
Well, all I can speak to is my experience yesterday, and it was truly a profound experience. Of course, I have heard many times before, especially in my riding of Thunder Bay Superior North, stories of people who are residential school survivors. But on this first national day of truth and reconciliation, to see the community come together in such a large way to listen to the stories of Indigenous people and to commemorate, in our case, the site of a former residential school, to listen to the chiefs and the various individuals and elders share their story was very, very moving, and it was an honor to participate. And so for me, this day will have a profound legacy for Canadians and for Canada. And I think of the words of the newly sworn in Governor General, Mary Simon, who reminded us all that reconciliation is indeed a journey, and that what we're doing as a country and as Canadians right now are planting the seeds of a garden for our children. And I thought it was the most beautiful way to summarize what this National Day hopefully will become for Canadians.
Thank you for that, Minister. You didn't address the core of the question about your reaction to the Prime Minister being on a beach in Tofino, but I do have to ask you about something else, and that is the Merck pill that has been, they've requested it for emergency authorization in the United States. I know that that's in the approval process right now with Health Canada, but would Health Canada consider emergency use of this pill for COVID-19?
So we have a very different process of approvals than the United States, who has an emergency approval rather than a rolling regulatory approval process that we implemented at the beginning of the pandemic. So, for example, you may have heard in the U.S. the debate about emergency use authorization of vaccines and other medications versus permanent use authorizations. We don't have that distinction here in terms of the ways that we've been doing approvals. The best person to speak to about this, though, in detail would be Dr. Sharma, who will come on afterwards, and is the head of our regulatory body. And I'll just say that, again, the regulatory body of Health Canada is extremely well positioned to do very rapid rolling reviews, and they don't stop once the approval is received. There's an ongoing data and safety check that allows for Health Canada to be able to change, for example, instructions of use, or in worst case scenario, revoke use for specific medications or devices. So I'll let Dr. Sharma add more detail when she speaks with you.
David Aiken, Global News. Congratulations on your re-election, Minister.
Thank you, David.
I want to pick up on something Travis talked about. I noted you yesterday, many your cabinet colleagues participated in a reconciliation event as you probably wanted to walk down the path of reconciliation and the Prime Minister wanted to walk down a beach. Does that not set back efforts to reconcile when Indigenous leaders look at the Prime Minister and they don't see him setting example that you and your cabinet colleagues set?
Well, I think what's I heard from the Indigenous people that I spoke with, including former Grand Chief Alvin Fiddler, as you know, and Deputy Grand Chief Annabette Ashni-Pinescom, and many other Indigenous leaders that were at the event yesterday in Thunder Bay, Ontario, was the historic enormity of a day that recognizes the ongoing colonization that Indigenous people face. It was obviously focused heavily yesterday on the experience of residential school survivors and their families and the historical sort of trauma. But I think there's a broader acknowledgement that it's also about the ongoing ways that Canada perpetrates that trauma on Indigenous people. And so for me, it's hard to put into words how moving that day was and how moving it was to see so many citizens out meeting with Indigenous people and hearing stories that I know for sure some have never heard before. And to me, that is reconciliation. It's relationships. It's not one day. It's not a T-shirt. All of those things help to raise awareness. But I said this in the campaign, and I truly mean it. And I said it yesterday in my remarks, that reconciliation is just a word if it's not built on relationships. And that the best way to reconcile and to begin to reconcile is to get to know the Indigenous people in your own community, one by one, family to family, colleague to colleague. And so I'm really, really proud to be part of a government that has helped with so many opportunities for Canadians to do that.
Probably a lot of people agree with you, and I think I know the answer. I think I know what you might say, but I'm going to rephrase the question. It was a statutory holiday. You could have taken the day off. You could have taken the day off, as some in your cabinet did, one particular person, but you chose not to take the day off. Why did you decide not to take the day off yesterday?
Well, I can't speak to other people's scheduling. I know the Prime Minister was at an event the evening before with survivors, but I honestly don't have the details of his schedule. I can just speak to mine, as I have, which is that I was invited to an event. I was able to attend, and it was an honor to be there. It's an honor, and it's an interesting opportunity as an elected official to meet with Indigenous people in our communities, as I know the Prime Minister does, by the way, all across the country, to hear what more we need to do as a country. And there is so much more that we need to do. And so to all Indigenous people across the country who shared their personal stories and wept and allowed themselves to be vulnerable, to share those incredibly painful stories, thank you. Thank you. I saw you. I saw you on TV. I saw you in person. And I personally know that this journey is just beginning.
Kevin Gallagher, CTV National News. Minister, as you mentioned, we're grappling with the fourth wave, and in many parts of the country it's heading worse than others. In Saskatchewan, Alberta, and British Columbia, they're asking for more of the Janssen vaccine. I know you were asked about this earlier. How many doses does Canada have on reserve, and is this the type of strategy you think that is necessary now if there is vaccine hesitancy for mRNA? Is that the right way to combat it, by offering some people a different vaccine?
Well, for part two of the question, I'll just say we've always said that we'll be there for provinces and territories with the tools that they determine that they need in their fight against COVID-19. Obviously, this is a medical decision, and I know that Dr. Hinshaw will have guidance. I know that Dr. Tam is working closely with her colleagues, her Chief Public Health Officer colleagues across the country. And so I will trust in the decision of the scientists and the doctors who will make those difficult decisions. And in terms of whether or not we have doses on hand, currently we don't have usable doses on hand, and so we're looking for additional doses so that we can get them very quickly to the provinces and territories, although we do have contractual offers, as you know, with the corporation.
The fact that Canada doesn't have usable doses, is that because of, just maybe remind me, because I'm trying to trace it all. There was the issue with the factory in Baltimore, right? The production facility. Why do we not have usable doses now? Because, as you mentioned, Canada does have a contract with Johnson & Johnson to have a certain amount. So perhaps you could enlighten me as to why we don't have those doses now when provinces say they need them.
Well, first of all, the regulators will never approve a product to come into Canada until they're completely safe for use. And so, as you know, the regulatory process is not just the vaccine itself, but also where the vaccine is manufactured, right down to the various lots and batches of vaccines, and that work is underway right now. There are a number of options, and I believe my colleague, Minister Anand, could speak more clearly about all those options, but there are other plants and options that we're exploring as we speak in terms of where we can access doses. And as I said, we'll be working on this very quickly so we can get them as quickly as possible to the provinces that wish to use them.
All right, thank you. We'll take, we'll do two more questions on the phone and then two questions in person if we can. Operator, over to you.
Thank you. Merci. The next question is from La prochaine question est de Louis Blouin, Radio-Canada. Please go ahead. À vous la parole.
Bonjour, Madame la Ministre. I want to ask you about a mandatory vaccination of the public servants. In your view, for mandatory vaccination to be efficient, should a proof of vaccination be requested?
If I understand the question correctly, you're asking if a proof of vaccination should be requested for a mandatory vaccination program. Did I understand that correctly?
Yes, exactly. Is that for the mandatory vaccination to be efficient? Should a proof of vaccination be requested?
I think listen, I think, Louis, thank you for the question. I think the operational details will vary from office to office. I can't really speak to that. I'm not involved in the design of the operational details. As you know, different places have different sizes of offices. For example, in our office, my small office in my constituency team, there's about 10 people. They've all shown their proof of vaccination, which I have asked for as an employer, and now they have, and I don't need to request it again. So I think it is an operational detail that we can certainly come back to you on.
Okay, next question about the third doses. Some provinces, as Quebec, suggested that there would be a third dose for older people. NACI recommends a third dose only for immunosuppressed people. Do you think this definition or recommendation should be, widened? Do you think that could be coming?
That would be a good question for Dr. Tam, who will come on just after me. As you know, my job as the Minister of Health is not to second guess the professionals and medical experts that are making those decisions, but to enable them to make them as quickly as possible with resources, whether it be money or people or other resources that they need to make those decisions. We've always said that it is science that will lead the way. And so from our perspective at the federal government, we support the work of NACI. We support the work of the Public Health Agency of Canada. But I would encourage you to ask Dr. Tam that question because she may be able to shed more light on it.
Okay, thank you. Operator, next question.
Thank you. Merci. The next question is from La prochaine question est de Ryan Tumulty, National Post. Please go ahead. À vous la parole.
Yeah, Minister, earlier this year and before you've suggested that there will be some manner of review of the government's performance during COVID. I'm wondering if you can give us more details now that the election's over and behind us about what shape that review might take and when will it move forward.
Well, thank you, Ryan. And you're right. I've been really clear that I not only hope that there's a review, I would expect that all countries do a formal review of their pandemic response. I think we've all had a lot of lessons that we've learned, and there are a lot of things that we could, as a nation, but certainly as a globe, do better in any other health threat that we will undoubtedly face as a world and as a country. In terms of details about how that might unfold, there have been a number of reviews already. As you know, the GFIN, the Global Public Health Information Network, underwent an independent review, and there's a report on how to bolster GFIN here. Those kinds of things, I think, are pieces of what I believe we need to do, which is a national review. And I really can't speak to the timeline. As you know, we've just been re-elected as a government, and so I will be working with my colleagues to determine how that is most appropriately done.
Yeah, and just on the situation in Alberta and Saskatchewan, you talked today about the federal resources that you're providing, but there's a lot of concern that Alberta is not doing enough to limit the number of new COVID patients that it is seeing. Obviously, federal resources are finite. You can only offer so much help to them. Are you concerned that the Alberta government isn't doing enough to ensure new patients don't just keep flooding into ICU wards?
As the federal health minister who has been on this file for the last year and a half, almost 2 years, I would say that case growth is always concerning. That when we see people getting sick in high volumes, we know that means that a certain percentage of those people will become hospitalized, and yet another percentage of those people will become so severely ill they need ICU, intensive care unit resources, and then of those, some people will sadly die. So I think we all need to be doing what we can do to reduce the spread of COVID-19, and we have the tools at hand now. We know what works, and we know that the sooner that we can reduce that spread, the sooner we can put out the flames of COVID-19 in these outbreaks. So that is why my remarks at the top of this press conference really stressed to Canadians, in particular Canadians in areas with high COVID transmission, not to take the virus lightly, even those people who are vaccinated, to be careful, because of course there's a higher risk even for vaccinated people. If there's a lot of COVID in your community, then there is an elevated risk even for vaccinated vaccinated individuals. The goal is really to have as little COVID as possible in our communities. Some people would say we should have no COVID. Perhaps that is achievable, but I do know that working together, we can keep those case numbers down. And I want to give a special acknowledgement to the Thunder Bay District Health Unit, my own health unit, who has achieved a 90% first dose, 83% second dose, maybe it's higher now, immunization rate, which has really, really helped, but also the ongoing cautiousness around public health measures to make sure that people are continually communicating how to reduce those risks. And it really is on all of us. We have to act together. This virus exploits the differences amongst us. It's an opportunity if we act together to reduce those numbers, which, by the way, are actually people that are getting sick. And finally, I'll just say this, it's scary to think that the highest case growth rate is in the 0 to 19 age category. So think about that. The people that are the most likely to get sick right now are our children. So we do need to do everything within our power individually to protect the kids in our communities.
Merci. Nous avons 2 questions ici dans la salle et après ça, le temps pour une dernière question par téléphone. Christy, over to you.
Hi, Christy Kirkup with the Globe and Mail. Just respectfully to go back to the Tofino situation for a second, why can't you say anything about the Prime Minister's decision to do what he did yesterday?
Well, I think I have answered the question. And I think that, again, to talk about yesterday, the most important piece of yesterday was the voices of Indigenous survivors. I'll just bring us back to the stories that were shared and the incredible coverage throughout the national media of Indigenous voices and the number of people that stepped up from communities across the country to listen to those voices. That's the importance of yesterday. And I don't want it to get lost. I want to make sure that when we talk about the National Truth and Reconciliation Day, that we're honoring the voices of Indigenous people. That's what it was about. It was about listening to the voices of Indigenous people, reflecting on the trauma that Indigenous people have faced in this country since contact and continue to face in many respects. And I want to make sure that those voices are heard first and foremost.
Respectfully, Minister, the reason that I'm asking you this question about what the Prime Minister did is because he took a decision to take a trip to Tofino, and some people, including Indigenous leaders and experts, are saying that this is drowning out the voice of Indigenous leaders and survivors on what was a very solemn and important day for the country. So does that make your job as a government harder, the signal that this sends to Canadians about the commitment to reconciliation?
Well, what I saw in my community was a commitment to reconciliation. The number of people that were at the events, the number of people that shared their own personal stories, including Indigenous people, the reckoning that so many communities are having around the impact of a colonial history that has been so damaging to Indigenous people. It's our first ever National Truth and Reconciliation Day, and it is a legacy. It's a legacy for this country. And again, I think the person that said it the best was the Governor General when she said, we are planting the seeds of the garden for our children and grandchildren. I can't think of a more beautiful way to describe what this work is all about.
Mike Blanchfield, Canadian Press. Following on your comments about children and risk earlier, why haven't the companies submitted their data to Health Canada yet? I mean, are you concerned about a delay in that? Is it because the government wants more information or a higher data sample or something else? Can you elaborate on that a little bit?
Those questions will be probably best put to Dr. Sharma, who will be here shortly, but my understanding is it's not a delay of data or any kind of snafu, if you will, with the companies. There are ongoing conversations with the companies, and we anticipate we'll get that submission in the very near future.
And now that 80% of people over 40 are fully vaccinated, and there's been a large uptake in 18 to 39-year-olds, what can the government do to target younger people who aren't getting vaccinated? And at what point can you say you've come far enough?
Right. Well, of course, the more of us that are vaccinated, the less foothold the virus has to infect people who are unprotected through lack of vaccination. And so for me, obviously, we want to get as many people as protected as possible. In terms of what we can do, we've been a partner to provinces and territories, as you know, on vaccination, not only through the purchase and acquiring of vaccines and distributing them to provinces and territories and making sure that that's available without any worry about the financial aspect of that. So this federal government continues to do that, really on all equipment, by the way, PPE, therapeutics, medical equipment. But we also have run ongoing media campaigns. We've funded innovation challenges for not-for-profit groups that work with a variety of different segments of our communities, whether it be unionized workers, multicultural groups, people with language barriers or other barriers, and we'll continue to be there to partner with provinces and territories so that they can get the job done.
Okay, and we have time for one last question on the phone. Operator?
Thank you. Merci. The next question is from La prochaine question est de Jamie Moricher from Global News. Please go ahead. À vous la parole.
Hi, Minister. Thanks so much for taking my question. I just have two quick ones. One being, are you able to tell me exactly when Alberta can expect that human resources help? I know you said 24 hours for PPE and stuff like that, but a little longer when you're sending people.
Yeah, we're working right now with Alberta on the details of exactly what kinds of professionals they need and where. So as soon as we have the granular details through the RFA process worked out, then we'll be able to begin to deploy.
Are we talking a week or less than?
It depends on the details from Alberta. We are waiting to hear who they need and where and what kinds of professionals. And as soon as we have that detail, we'll begin to put together the plan on how to get them to the province very quickly.
Okay, and then my follow-up to you is back in August, the Premier of Alberta said that he didn't need a lecture from you when it came to handling COVID-19. He's kind of pushed off help from the federal government up until accepting it yesterday. At this point, the province is kind of past the tipping point, according to frontline workers. Do you wish, or is there a way, I guess, that the federal government could have stepped in a little bit sooner? And are we waiting for things to get worse in Saskatchewan, or it's kind of on the same trend where we're putting off the ask for help until what?
Well, the letter was sent because, of course, from the people that advised me at the Public Health Agency of Canada, there was a high degree of concern around the measures that Alberta was proposing dropping at the time. And there was modeling that showed by Dr. Tam and the Public Health Agency of Canada that if we, even with vaccination, released measures too quickly, we would see a resurgence. And that's exactly what we have seen. In terms of the requests for assistance, I can't speak to their processes. I can say that the offer has been ongoing. Even during the election, the officials were working every day with the officials from provinces and territories to make sure that they knew those requests could come in at any time and that we would work to fulfill them. And that's exactly what we're doing with these requests. So all I'll say is that the reality is that we have to follow the science, that the virus doesn't respond to what we wish it would do. It is the case growth is unavoidable if we don't take the appropriate measures. And when I say case growth, I want to remind everybody that these aren't cases. These are people. These are now people's children, people's fathers and mothers. It is skewing younger, of course, because we do have such a high rate of vaccination in elders. And so we need to do everything we can together, provinces, territories, the federal government, and individual Canadians to protect each other so that we can get through this, get more people vaccinated, and finish the fight against COVID-19. Thank you.
All right, thank you, Minister. Thank you, media, for your questions. This concludes today's press conference.
Average of over 4,350 new cases being reported daily across Canada. However, severe illness trends are still increasing, with an average of more than 2,400 people with COVID-19 being treated in our hospitals each day, including almost 800 in intensive care units, and 38 deaths were reported daily. COVID-19 cases and hospitalizations are predominantly occurring among unvaccinated people. From mid-August to early September, the average weekly rate of new COVID-19 cases was 10 times higher, while the average weekly rate of hospitalizations was 38 times higher in unvaccinated people than in fully vaccinated people. Although very high vaccination coverage is needed to offset the highly contagious Delta variant, COVID-19 vaccines are making substantial contribution to population protection. Where vaccination coverage is lower and rapid epidemic growth is occurring, public health measures are crucial to rapidly reduce contact rates that fuel virus spread. Administering vaccines and building up immunity across the population takes time, but reducing the pool of susceptible people through vaccination is also vitally important for preventing severe and/or potential long-term complications of COVID-19 infection that puts pressure across the health system. Increasing vaccination coverage quickly can also help reduce the duration and overall impact of the Delta wave on healthcare, schools, businesses, and other essential services. Experience the world over has shown that what works best is a combined approach of achieving high vaccine coverage, making indoor spaces safer through improved ventilation, and individual layers of protection, such as masking and spacing, and reapplying public health measures to slow the spread and minimize serious illness where the virus is surging. This week, Canada's National Advisory Committee on Immunization released updated guidance recommending an mRNA COVID-19 vaccine booster dose be given to residents in long-term care and seniors in other congregate settings who are at higher risk of exposure and serious illness. NACI is also advising that COVID-19 vaccines may be given at the same time as or any time before or after other vaccines. This is great news and means that COVID-19 vaccines can be co-administered with other vaccines. This will make it easier for people to get their influenza vaccine this fall, as well as catch up with other routine vaccines that may have been delayed during the pandemic. Thanks to the added protection of COVID-19 vaccines, this is the first time since the pandemic began that we will gather in larger numbers indoors this fall and winter. While our protection against COVID-19 has been bolstered by vaccines, we also need to think about the return of other respiratory infections. In addition to getting up to date with recommended vaccines such as influenza and other routine vaccines for children and adults, we can stay healthier by keeping up with hand and cough hygiene practices, getting the best ventilation possible in our indoor spaces, and staying home and away from others if we develop symptoms. Finally, I'd like to end by acknowledging that yesterday was the first National Day for Truth and Reconciliation. Going forward, we can continue to honor those who were lost and show compassion for survivors by listening, learning, and striving to understand the ongoing impacts of residential schools on First Nations, Inuit, and Métis people and communities. There are many learning resources on the National Day for Truth and Reconciliation website, which I will link to from my remarks posted online. Thank you. Merci, Megwidge.
Bonjour à toutes et à tous. Aujourd'hui est la Journée nationale des aînés.
Hello, everyone.
Cette
Today
journée
is
vise à
National
nous
Seniors
rappeler
Day,
combien les aînés jouent un rôle
reminding us
important dans nos
of the
vies
important
et à nous
contribution
montrer
of
comment
elders
nous
in our
pouvons leur
lives
rendre l'appareil
and
chaque
how we
jour
can give back
en leur
every day
consacrant du temps,
with our time,
en les accompagnant et en
companionship,
les soutenant.
and support.
Selon les plus récentes données de
The
surveillance,
latest surveillance
l'activité de la
data
maladie
show
continue
ongoing
de
regional
varier d'une
variation
région à
in
l'autre.
disease activity.
Mais en général, la croissance de
But
l'épidémie
overall,
semble relativement
epidemic
stable
growth appears
à
to be
l'échelle du
fairly
pays.
stable
Au
nationally.
cours de la dernière semaine, plus de 4 350 nouveaux
Over the
cas
past
ont été
week, there were an
signalés en
average of
moyenne
over
chaque jour au Canada.
4,350 new
Cependant,
cases
les
being
tendances
reported daily
relatives
across
aux cas
Canada.
graves continuent d'augmenter.
However,
En
severe
moyenne,
illness
chaque jour,
trends are
plus de
still increasing,
2400
with
personnes
an average of
atteintes de
more
la
than
COVID-19
2,400
sont
people with
soignées dans nos
COVID-19
hôpitaux,
being treated
dont près de
in our
800
hospitals
dans les
each
unités
day,
de soins intensifs et 38 décès sont
including
signalés.
almost 800
Les
in
cas de
intensive care
COVID-19,
units, and
les
38 deaths were
hospitalisations
reported daily.
surviennent principalement chez les personnes
COVID-19
non
cases and
vaccinées.
hospitalizations
De
are
la
predominantly
mi-août au
occurring
début de
among unvaccinated
septembre,
people.
le taux hebdomadaire
From
moyen
mid-August to
de
early
nouveaux cas
September,
de
the average
COVID-19
weekly
était
rate of
10
new
fois plus
COVID-19
élevé
cases was
et
10
le
times
taux
higher,
hebdomadaire moyen
while the average weekly
d'hospitalisation
rate of
était 38
hospitalizations was
fois
38
plus
times
élevé
higher
chez les
in
personnes non
unvaccinated
vaccinées
people
que chez les personnes
than in fully
entièrement
vaccinated
vaccinées.
people.
Si une couverture vaccinale très élevée est nécessaire
Although
pour faire
very
échec
high
au variant
vaccination
Delta,
coverage is needed
qui
to
est
offset the
hautement
highly
contagieux,
contagious
les
Delta
vaccins
variant,
contre la COVID-19
COVID-19
contribuent
vaccines
largement
are
à la
making a
protection de la
substantial contribution
population.
to population
Dans les
protection.
régions où la couverture vaccinale est plus faible et où il y a une croissance rapide de
In
l'épidémie, il
regions
est
where
essentiel de
vaccine
prendre des
coverage is
mesures de
lower
santé publique pour
and
réduire
rapid
rapidement les
epidemic
taux
growth
de
is occurring,
contact qui
public health
favorisent la
measures are crucial
propagation
to
du
rapidly
virus.
reduce
La
contact rates that fuel
vaccination et
virus
le
spread.
renforcement de l'immunité de la population
Administering
prennent
vaccines
du
and
temps.
building up immunity
Or,
across the
il y a
population
une
takes time.
importance capitale de réduire le
But
nombre de
reducing the pool
personnes
of susceptible
vulnérables
people through
en
vaccination
recourant
is
à la
also vitally
vaccination
important
pour prévenir
for
les
preventing
complications
severe
graves ou de longue
and/or
durée
potentially
liées
long-term
à la
complications of
COVID-19 qui
COVID-19
exercent des
infection
pressions sur le système de
that put
santé.
pressure across
De
the health
plus,
system.
l'augmentation rapide de la couverture vaccinale
Increasing
peut
vaccination
également
coverage
contribuer
quickly
à
can
réduire
also
la
help
durée de
reduce
la
the
vague
duration
causée par le
and
variant
overall
Delta
impact
et
of the
ses
Delta wave
répercussions
on
globales
healthcare,
sur les soins de santé,
schools,
les écoles, les
businesses,
entreprises et d'autres
and other
services
essential
essentiels.
services.
D'après l'expérience acquise dans le monde entier,
Experience the world
l'approche
over
la plus
has shown
efficace
that what
consiste
works
à
best
combiner une
is a
couverture
combined
vaccinale
approach
élevée avec l'amélioration
of
de la
achieving high
sécurité des
vaccination
espaces
coverage,
intérieurs
making indoor
grâce à une
spaces
meilleure
safer with
ventilation de
improved
ceux-ci
ventilation
et l'application des
and
mesures de
individual
protection
layers of protection,
individuelles comme le port de masque et la
such as
distanciation
masking and
et
spacing,
la remise en place de mesures
and
de santé
reapplying
publique
public health
visant
measures
à ralentir
to
la
slow the spread
propagation et à limiter le
and
cas de
minimize
maladies
severe
graves
illness
en
where
cas
the
de
virus is
recrudescence du
surging.
virus. Cette semaine, le Comité consultatif national de
This week,
l'immunisation, ou
Canada's National
CCNI du Canada,
Advisory Committee on
a publié des
Immunization, or
lignes
NACI,
directrices
released updated
actualisées
guidance
recommandant à
recommending
l'administration
an mRNA
d'une dose de
COVID-19
rappel
vaccine
de
booster
vaccin
dose.
ARN messager contre la COVID-19
That this
aux
booster dose
résidents
be
des
given to
établissements
residents
de soins
in
de longue
long-term care
durée
and
et aux
seniors
personnes
in
âgées
other
vivant
congregate settings.
dans d'autres établissements collectifs qui présentent un risque plus élevé d'exposition
People who
et de
may have a
maladies
higher
graves.
risk of being
De
exposed
plus,
to the
le
virus
CCNI
and
a
severe
indiqué
illness.
que les vaccins contre la COVID-19 peuvent être
In addition,
administrés en même temps
NACI is
que
also
d'autres
advising that
vaccins ou à
COVID-19
tout
vaccines may
moment
be given at the
avant ou
same
après
time
leur
as or at any time
administration.
before or
C'est
after
une
other
excellente
vaccines.
nouvelle. Cela
This is great
signifie que
news
les vaccins contre la
and
COVID-19
means that
peuvent
COVID-19
être
vaccines can be
administrés
co-administered with other
conjointement
vaccines.
avec d'autres vaccins. Il sera donc plus facile pour les gens
This
de
will
se
make it
faire
easier
vacciner
for
contre la
people to get
grippe
their
cet
influenza
automne
vaccine
et
this
de
fall,
recevoir tout autre
as
vaccin
well as catch
prévu
up with other
au
routine
calendrier de
vaccines that may have
vaccination
been
qui
delayed during
n'aurait
the
pas
pandemic.
été administré pendant la pandémie. Pour la première fois depuis le début de la
Thanks to the
pandémie,
added protection
nous
of
pourrons nous
COVID-19
rassembler en
vaccines,
plus grand nombre à
this is the
l'intérieur
first
cet
time since the
automne
pandemic
et cet
began that we
hiver
will gather
grâce
in
à la
larger numbers
protection accrue
indoors this
qui
fall
confère les
and
vaccins
winter.
contre la COVID-19. Toutefois, si les vaccins ont
While our protection
amélioré
against
notre protection
COVID-19 has
contre la
been bolstered by
COVID-19, nous
vaccines,
ne devons pas
we
oublier que
also
d'autres
need to think
infections
about the return
respiratoires
of
font
other
leur retour.
respiratory infections.
En plus de recevoir les vaccins
In
recommandés,
addition to
comme le
getting up to
vaccin
date
contre
with
la grippe,
recommended
et ceux
vaccines,
qui sont prévus au calendrier de
such as
vaccination
influenza
pour les
and other
enfants
routine
et les
vaccines for
adultes,
children and
il
adults,
convient de prendre d'autres mesures
we can
pour
stay
rester en
healthier
bonne
by keeping
santé,
up with
comme
hand
se
and
laver les
cough
mains,
hygiene
tousser dans les creux du
practices,
bras, optimiser la
getting the
ventilation
best
des
ventilation
espaces
possible in our
l'extérieur
indoor
et rester
spaces
à la maison et à
and
l'écart
staying
des
home and
autres
away
si
from
nous
others if we
développons des
develop
symptômes.
symptoms.
En terminant, j'aimerais souligner qu'hier était la
Finally,
première journée
I'd like to end by
nationale de la
acknowledging that
vérité
yesterday
et de
was
la
the first National Day
réconciliation.
for Truth and
Grâce à cette
Reconciliation.
journée annuelle, nous pourrons à
Going
l'avenir
forward,
rendre hommage aux
we can
disparus
continue
et
to
faire
honor
preuve de
those who were
compassion
lost
à l'égard
and show
des
compassion for
survivants en
survivors
écoutant leurs
by
récits,
listening,
en enrichissant nos
learning,
connaissances et en nous
and
efforçant de
striving to
comprendre
understand
les
the ongoing
répercussions des
impacts of
pensionnats
residential
sur les
schools
peuples et les
on First
collectivités des
Nations,
Premières Nations,
Inuit,
des Inuits
and
et des
Métis
Métis.
people and
De
communities.
nombreuses ressources d'apprentissage
There are
sont
many
proposées
learning
sur le site
resources
web
on the
de la
National
Journée
Day for
nationale
Truth
de
and
la vérité
Reconciliation
et de la
website,
réconciliation. Vous trouverez un lien vers ces ressources
which I
dans
will
les
link
versions
to
texte
from my
de notre
remarks
allocution
posted online.
affichée en ligne. Merci.
Thank you.
Thank you.
Merci,
Miigwech.
Miigwech.
Merci, Dr. New and Dr. Tam. Thank you. We will now open the phone line to questions. We ask that you limit yourself to one question and only one follow-up. As usual, we'll be taking questions in both official languages. Donc, nous allons prendre vos questions au téléphone. Nous vous demandons de vous limiter à une question et seulement une question de suivi. Vous pouvez poser vos questions dans l'une des deux langues officielles. Operator, first question. Opérateur, première question, s'il vous plaît.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Ryan Tumulty, National Post. Please go ahead. À vous la parole.
Yeah, hi there. I guess this question is probably best for Dr. Tam, but I'm wondering on vaccine hesitancy. The government is taking, I guess, some sort of stick approaches by imposing mandates and things like that. I'm wondering, what PHAC is doing on the carrot side, and maybe from previous campaigns, what you have known works and doesn't work when it comes to getting people to get vaccinated.
Yes, thank you for that question. And I'd point out that I was really happy to see that there's been a jump in first dose uptake in Alberta and in Saskatchewan, for example. So some of the latest action collectively by different levels of government, I think, is making some difference in the uptake, which is great, and we just need to keep going. From the Public Health Agency perspective, we have been using many different approaches to combat vaccine hesitancy or boosting vaccine confidence, including providing different media formats, social media, videos on our website from experts in terms of answering questions that people have. So providing answers to the leading questions that the general public have is very important. But also providing support, including grants and contributions to communities, to community leaders, community organizations who are trusted by their communities in order to increase vaccine confidence is also really important. There's no one size fits all, and many different approaches are needed. The other thing is access. So working with Indigenous Services Canada, Indigenous organizations, many people on the ground, the provinces and territories, and local public health to increase the access, whether it be mobile clinics or other means, is extremely important still. Working with the business sector in terms of providing them with tools, information that they can use for their employees is also really important, because they're going to have to answer questions from the employees as they put together the workplace requirements for vaccination, etc. So I think there are many different approaches. In terms of what things have worked, I remember there was a question a couple of weeks ago, maybe, on whether vaccine requirements work. And at that time, really, there's only empiric evidence and evidence from the application in other areas, such as school requirements for childhood vaccinations. But I do think that whether, I would say, together with other measures, these vaccine requirements in provinces seem to have nudged people to take up the vaccine. As I said, in Alberta, the first dose coverage went up by 4% just in the last while, which is tremendous. Just keep up the good work.
It's Dr. New here. Maybe I can add underline a couple of points of what Dr. Tam said. So certainly when you're looking at the carrot approach, as Dr. Tam mentioned, we have something in the federal government called the immunization partnership fund, and really it's a way to support local communities, specialized communities in terms of the leadership that can reach with sort of unique ways their target audiences in a way that let's say medical officials like Dr. Tam, myself, can't at a national level. So that's very important, and we have certainly seen quite a range of very innovative approaches from these community leaders. The other thing I think we're doing that's I think been successful is looking at using what we call a segmented social marketing approach. And one of the target audiences I think we mentioned previously is sort of the young adult male population. So we've also worked closely with, quote, the gaming community, looking at the sort of leaders, role models in that community to also get the message across about how important it is to get vaccinated. And hopefully that's also having an impact. And finally, I would say that, in a positive way, I think things such as vaccine passports that I think, various governments in the provinces and territories have put in, I think have been effective because at the end of the day, I think it's about giving privileges to those who've made, I think, the right decision to get vaccinated so that they can undertake certain activities, go to a restaurant, to go to a sporting event and so on. Because I certainly when I have gone into those establishments, I feel much more comfortable and safe knowing that everyone around me as well has taken the decision to get vaccinated. And we're all sort of not only protecting ourselves, but protecting each other. So I think with all of those range of tools, those are some of the ones that we're seeing are having a positive impact right now. Thank you.
Thank you, doctors. Follow up?
Yeah, I'm just wondering if you have modeling or have looked at research as expect to be the necessary level of vaccination to finally put an end to the pandemic. I know it's probably going to involve vaccinating people from 5 to 11, but I'm just wondering sort of what the target has to be.
Yes, it's Theresa Tam. So the Delta variant, of course, being more transmissible, has led to an increase in vaccine coverage level requirement to help move towards community immunity or herd immunity. So that's been the latest challenge, which means that you have to have very high vaccine coverage. But the vaccine coverage level required is also dependent on your local epidemiology. For example, how many people have had past infections, as well as the vaccine uptake, and also the contact dynamics of the population, whether you're densely populated or sparsely populated population, or whether you've got a congregate living or not so crowded living conditions. So the reproduction number, which you've heard in our modeling sessions, is how many people would a singular infected person with, say, the Delta variant infect, can vary in different contexts. So that's all to say is that this is not a static estimate, but can be different for different communities and populations across the world, but certainly even within Canada. We know that with a reproduction number of around 5 or 6, for instance, that you will need around, over 80% vaccine coverage to move towards herd immunity or community immunity. So that is a particular target. That's the denominator of which is the total population, not the eligible population. So that is one parameter we can look at, but there needs to be an understanding more locally as to what that target might be. But all to say is, as I've said, go big, go as much as possible, reach for the stars, get to 100% if you could, even though that seems like a stretch goal. That's what you need to do with a very transmissible variant.
Thank you, Dr. Tam. Opérateur, prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Louis Blouin, Radio-Canada. Please go ahead. À vous la parole.
The question is for Dr. Tam, but Dr. Sharma, feel free to answer too. Government officials are putting together a mandatory vaccination model for public servants. Do you think it would be preferable to ask for proof of vaccination, that this mandatory requirement be paired with a request to give a proof of vaccination? Would you recommend it?
So, if I understood the question correctly, it's about the vaccine requirement for the federal public service. Is that correct?
Yes. Yes.
Yes. So the Treasury Board and others are working hard at this, and there's a rapid implementation phase that we expect to happen. As the public health agency, will provide guidance, but the execution and operationalization is up to the employer. That they are now figuring out the instructions to staff in terms of providing, for example, attestation of their vaccination status. So all of that is still in the works, but I expect that there'll be implementation announcements pretty soon on exactly what employees need to do.
But don't you think that it would be more efficient if there was a proof of vaccination requested? I'm asking about maybe your expert advice on that.
Yes, there will be, I think, involved in this process a request for submission by staff of their vaccination status. If what you're talking about is should people show proof upon entry to different buildings, that is an operational requirement that I think needs to be sorted out by the departments. But I think the concept is that you need to make it operationally feasible. So I'm not the executor of that plan, but I'm sure there'll be different modalities also being explored for different work contexts, whether you're public facing or not, for example, in terms of your work, or whether you're working in a office setting with no interaction with the public. So it's a complicated program to roll out. And there will also have to be arrangement for testing, for example, for those who can't get a vaccine.
Thank you, Dr. Tam. Operator, next question. Prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Kevin Gallagher, CTV National News. Please go ahead. À vous la parole.
Hello, my question is for Dr. Sharma, actually. So the United States and looks like Health Canada is looking at this treatment developed by Merck for COVID that seems to reduce hospitalizations. I'm wondering, there's a rolling approval now for Health Canada, but is there any expectation as to when that approval could be finished, or what this type of treatment could mean for the current situation facing many provinces dealing with a fourth wave?
Sure, thank you. So I think you're referring to the molnupiravir, which is a medication that's given within 5 days of the onset of symptoms. And there's been some clinical trials that have shown that it's been very successful in preventing disease. So Health Canada received that submission for molnupiravir on August 13th. And we're actually working with some of our international counterparts going through the review of that. The US FDA has yet to receive a formal submission, and they're expected to get it shortly, as well as the European Medicines Agency. So we are looking at it. Certainly we're going through, as we said, that the data, it does take some months to go through that. So we don't have a specific time for completion of that, but it'll be held to the standards of all of our reviews. And just to note that that's actually going through our regular review process. So it's not the interim order process. It is the review that we would do for all medications or treatments. But we've also incorporated the rolling submission process there so that companies can give us individual and additional information as it becomes available. So we are working on it. Again, we're working on it collaboratively with our international partners, and we'll authorize it if it meets the standards.
Thank you. Follow up?
Yes, I'd like to follow up on the Johnson & Johnson vaccine. There are some provinces that are requesting more supply. And I'm just wondering, perhaps there's a question here for Dr. Sharma, but also maybe a question for Dr. Tam. There seems to be a need to try and use the Johnson & Johnson one-shot vaccine for people who are still unvaccinated or those who have hesitancy towards the mRNA vaccines. Number one, there was an initial problem with some of the approval for the production facilities of some of these Johnson & Johnson vaccines. Canada currently doesn't have any stockpiled, but we're going to look for some. How soon could Canada get a hold of the required Johnson & Johnson? And is this strategy, it seems, by the provinces something that public health, approves of? Is it a good idea to try and combat vaccine hesitancy by using a different vaccine?
Sure. Maybe I could start on the regulatory side of things, and then I'll turn it over to Theresa and Howard. So the Johnson & Johnson or the Janssen vaccine is authorized for use in Canada. So it can be used. Again, it's right at this point in time, it is authorized as a one-dose vaccine. There have been some studies that have come out to show that there is added benefit from a second dose of the J&J vaccine to help boost immunity. And in some countries, they've already started to boost with a second dose, either of the J&J vaccine or in some countries like France with the mRNA vaccines. The supply situation is that it has regulatory approval. There are a number of different sites that do the manufacturing or the distribution or the packaging that are authorized. There are some sites that still have some issues around quality and quality manufacturing. So we would only allow the importation of Janssen vaccine that actually would meet all of those criteria. So we wanted to make sure that the level of safety and the effectiveness of the vaccine meets what was authorized. So we really would make sure that whatever was procured, the appropriate regulatory reviews of all of those sites that were involved in the manufacture and the distribution of the vaccine were up to par and up to standards, and then it would be allowed in the country. But in terms of the sort of supply and the use, maybe I'll turn that back over to Theresa.
Thank you, Dr. Sharma. So there has been some very recent discussions at the Special Advisory Committee with the other Chief Medical Officer. Given some provinces have an interest in accessing some J&J or Janssen vaccine doses in this last mile of trying to get their populations vaccinated, I just want to reiterate that the mRNA vaccines are safe and effective. The viral vector vaccines also includes the AstraZeneca vaccine and the Janssen vaccine. As Dr. Sharma said, that the Johnson & Johnson Janssen vaccine may benefit from a second dose. So I think for individuals who are thinking about this as a one-dose vaccine, more information is likely to be forthcoming in the near future on that. The National Advisory Committee is also examining the need for additional vaccines, including for individuals who've actually had a viral vector vaccine such as Janssen. So we expect more to come from that committee as well on this front. Having said that, a number of chief medical officers have indicated that, well, it's better than not vaccinating certain individuals if that is the only vaccine that is accepted by certain populations. So with that principle in mind, we are trying to get some doses as fast as possible. I think one thing that we need from the provinces is a good estimation of the amount that is required. We do not want to waste any vaccines that can help other countries in the world. And so that is an ongoing exercise right now in terms of the outreach. And we're waiting for provinces to get back to us on that front.
Thank you, doctors. We'll now move to the next question. Opérateur.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque, La Presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous tous. Tout d'abord, je voulais peut-être entendre Dr. New en français sur
First of all,
ce
I'd
que
like to
Mme
hear in
Tam
French
vient
from
de
Dr.
dire
New about what
à
Dr.
l'effet
Tam was
que
just talking
vous
about
tentez d'avoir des doses de Johnson & Johnson.
regarding the
Je me
possibility of
demandais d'où est-ce
doses
que
of the
ces
Janssen
doses
& Janssen
viendraient
vaccine.
et puis
I'm
est-ce
wondering
que
where
vous
those
avez
doses would
donné
come
peut-être
from.
une date limite
And if
aux
perhaps you could
provinces pour qu'elles vous
mention
reviennent
whether
avec
there
un
would
nombre
be a
exact
deadline
de
for the
doses
provinces
demandées.
so that they could get back to you about the number of doses they're asking for.
Merci pour la question. Mais peut-être je peux aussi
Answer. Thank you for the question.
Une sommaire de ce que Dr.
And
Sharma
perhaps
a dit.
I can also summarize what
On est
Dr.
en train
Sharma said.
actuellement d'avoir des discussions avec nos
We are
homologues
currently
des provinces et
communicating with
territoires
our provincial and
concernant
territorial
peut-être
counterparts
la demande pour le
regarding
vaccin de Johnson
their
Johnson,
requests for the Janssen vaccine.
Mais comme Dr. Sharma a dit, de côté
As Dr. Sharma said,
de perspective réglementaire,
from a regulatory perspective, we always want to ensure that any vaccine entering Canada
passe les normes de Santé Canada
meets
pour
Health
la
Canada's
sécurité
standards
et aussi l'efficacité. Donc, je pense
regarding
qu'on a eu
safety and
des
effectiveness.
défis avec un établissement
So
de
I think
production aux
that
États-Unis, mais je pense
there
qu'avec la